Within the last couple of weeks, I've been playing some audio for you from Dr. Zachary Rubin, who has bemoaned the fact that medical information from the CDC has been shut off, or at least is being sent out, shall we say, fitfully. And he's been trying to post regularly on social media to let people know about public health disease outbreaks or drug recalls or food recalls or any information that he can possibly supply to people, since the official sources of information, shall we say, are unreliable these days. I wanted to speak with him at greater length about why he's doing what he's doing and also where he's getting his information. So I'm very pleased to introduce you all to Dr. Zachary Rubin, who's an allergist and immunologist with Oak Brook Allergists. And you can find his social media content on Instagram, YouTube, Substack, TikTok, Facebook. Look for Rubin_allergy. Dr. Rubin, thank you so much for joining us today.
Thank you for having me. It was funny because I didn't realize that you were talking about me until the woman who I bought her house from had texted me and said that she had heard you talking about me, and it was so lovely to hear you on the waves discussing these important issues, because it's been rather concerning to me as a physician about the pause in external communications from these federal health agencies.
Yeah, and I've been trying to keep an eye on this, and first, the CDC was told to shut everything down. Then the court said, no, that's not right. CDC needs to bring it back up. And frankly, I don't know where things stand right now, because some government agencies are following these court orders and some of them are not. So I think going forward, at best, the CDC will be unreliable. So one of the things that I was really curious about is where did you find out about things like the tuberculosis outbreak in Kansas and some of the other public health things that you've been talking about that normally we would go to the federal sites for?
Right. So the public health responses that occur in this country, it's not all federal. There are a lot of local public health responses and local news organizations that I rely on to get information. So the pause is not on the city, county, state level. So I can still go and find that information pretty quickly through just searching it myself, and then using my platform on social media, which has really been able to get the information out to people, just to be able to share that with folks. You know, I have a Substack that's a newsletter that people have subscribed to get this information in their inbox. I'll write it up. I'll make a quick video. I've been posting on social media regularly for the past 5 years, basically since the beginning of the pandemic. And what concerns me, especially in my allergy role, is that a lot of my patients have food allergies. So some of these food recalls that happen are due to the fact that there's undeclared allergens in there, which is what really motivated me to start doing this, because you will hear on a regular basis of a company stating that they had made a mistake. They put an undeclared allergen in there, and I don't want any of my patients or the greater food allergy community to suffer from the fact that the FDA is not able to send out their normal press releases. So you can still go to the FDA's website directly and find some of this information, or go find it at the manufacturer, or again at the local level, to get this information. And interestingly, some of these pauses have been lifted, and I got an email yesterday. Actually, I'm looking at my email right now, 4 of them, that were weekly recaps of these recalls that were as far back as January 19th and going all the way up to February 8th, that they essentially had this huge backlog of information that they did not send through their normal email alerts, through the normal press releases, and the media has been taking several days longer than usual to release this information to the public that I've been trying to stay on top of.
Yeah, well, I can tell you the media's a little bit overwhelmed right now. And while ordinarily that would be a really good source of this kind of information, like you said, it may not show up at all, or even if it is reported, it might be later than would be prudent. We booked this interview. We started talking about doing this last week when I still had hope for Health and Human Services, but indeed, the worst has happened, and Bobby Kennedy Jr. has been confirmed, despite Carolyn Kennedy going public and talking about what a terrible human being he is, despite all of the lies he's told legislators. No, I'm not anti-vax. I just don't think vaccines are safe. That's all. This is really a nightmare scenario. How do you see this playing out?
I think the anxiety that a lot of people are experiencing is that kind of fear of the unknown, because RFK Jr. is not someone who is a physician, who is not an expert in public health. He's a lawyer, and he has been known throughout his career of spreading a lot of disinformation and misinformation about vaccines. And so it's surprising to pretty much every physician that this happened. And so to be able to say what exactly will happen, we don't know. But what I'm trying to encourage people at this time to do is just what Mr. Rogers once said, which is to look for the helpers, because you know they're always going to be helping, right? And so people like myself and other healthcare workers and your own personal doctor will still be doing whatever they can to help inform the public about what's going on. There's still a lot that's going to be done at the local level that we will look at, and we will continue to try to do the best as we can as in terms of the scientific and medical community, despite what may be unknown at this time, to try to improve the health and well-being of our society.
I saw an article within the last month that saw Bobby Kennedy heading toward confirmation, and one piece of advice they gave was, right now, while everything is still relatively normal, reach out to your doctor, your own personal doctor. Reach out to the pediatrician who treats your kids, and make sure everybody in your family is up to date on every vaccine they can possibly get, just in case access or insurance coverage or even information about the information about the vaccine schedule has already been removed once. I don't know if it has reappeared. Would you say that's good advice? Would you tell people, you know what, send your doctor an email today? Am I up to date on all my vaccinations? And if not, when can I come in?
Right. I think that's sound advice from the standpoint of really the reality is there's several outbreaks occurring across the country of various vaccine preventable diseases such as measles. There's a big outbreak happening right now in West Texas. There are several cases in Atlanta. And so this occurs primarily in people who are either not immune because they can't get vaccinated or they chose not to get vaccinated. So there are people who are vulnerable to these potentially serious diseases. So regardless, I think it's important for everybody to make sure that they're up to date on their vaccines, regardless of who is heading the HHS or not. We've seen that the vaccination rates have declined since the pandemic has started to many states in the country. I don't believe Illinois is a part of that, but many states in the country are below the 95% threshold for herd immunity for the MMR vaccine to protect against measles, mumps, and rubella. Some of them are, even under 90%, and that is very concerning to me as a physician, because many physicians, including myself, who are on the younger side, haven't seen a lot of these diseases because they were essentially stamped out. And now you're expecting us to kind of learn and relearn some diseases that we don't normally encounter other than a couple questions on a standardized test, because vaccines were so effective at preventing these things. Now that we're relaxing a little bit, it's going to start coming back, unfortunately. Mm-hmm.
Before I let you go, one of the things that I don't know that much about that apparently Bobby Kennedy Jr. is a big proponent of is raw milk. Now, my understanding was that we started pasteurizing milk for a reason, and that the fear is that if he paves the way for more widespread distribution of raw milk or raw milk products, that could be dangerous. What can you tell us about that?
So we've been pasteurizing milk for over 100 years. It's a simple process, really. You're just heating up the milk to about 160, 165 degrees for about 15 seconds and cooling it off. That kills off viruses and bacteria. It makes it safe to consume. We know that, as an example, this emerging infection called highly pathogenic avian influenza or bird flu, H5N1 bird flu, can potentially be transmitted through raw milk. And so I always implore people to not drink raw milk because it can transmit these potentially deadly diseases. So I never recommend that. So I would imagine if there was potentially more access to raw milk, it's not to say that the general public will want to still consume it. There's just going to be some people who may be persuaded in a direction because they were told that it was beneficial and relatively safe, when we know that's not the case. And there's no significant benefit of just drinking straight raw milk compared to pasteurized milk. There's not really any change in nutritional content for it. And so all we have to do right now is continue to educate people about the risks associated with drinking raw milk, that people should just read their labels carefully to make sure that they are drinking pasteurized milk. It's not generally a problem right now for most people, but it's just something that we have to keep an eye on.
What one bit of advice would you like to share with our audience today?
I think it's important to stay skeptical about the information that you get from all of the sources. Even myself, as a physician who's on social media trying to help people, I think a healthy dose of skepticism is needed in order to encourage people to look at multiple resources, because when you look at multiple resources, if they are saying the same thing, including your own doctor, if your own doctor, who should be one of your most trustworthy people in your life, is able to agree with what you are hearing with, that will be helpful. But if they're telling you, no, this is not correct, here's where you should go get information, you're looking at multiple sources. I think that's really important right now. And it's also okay from time to time to turn off media and take a little bit of a break, because there's a lot of anxiety floating around right now because there are a lot of different changes. It's hard to keep track of things, but it's okay to take a little bit of a mental health break at times.
You know, I'm a part of the media, and I take mental health breaks. You know, over the weekend, I try really hard. Like, I'll pick up my phone and I'll be getting ready to push the Blue Sky app, and I'm like, no, don't do it. And you know what? It's hard, especially those of us who are really attached to our phones, but it's absolutely necessary. This is going to be a very stressful period in our lives, and I think that you are absolutely correct. Be careful of your own mental health, take the breaks you need, and be skeptical.
Yes.
Always try to find multiple sources of information to cross-check against one another. Dr. Zachary Rubin is one of the sources that I would suggest you add to your list. Again, you can find him on Instagram, YouTube, Substack, TikTok, Facebook, and just look for Rubin, Rubin _allergy. Thank you so much for talking with us. I have a feeling I'll be calling you again as things get really like the Wild West when it comes to health. I hope you'll join us again in the future.
Absolutely. It would be my pleasure to speak with you again, and I appreciate the work that you're doing. I hope you have a wonderful day.
Thank you. You too. That was Dr. Zachary Rubin. We are going to take a break. We'll be back with more after this.